Hey guys, what's going on? Dr. Frank here, founder of Addiction Mindset Recovery Coaching Programs. And in today's brief video, I want to take some time and talk about cannabis-induced psychosis. This is a growing problem. We have lots of people reaching out to our offices asking about this condition. It was something that I started to experience myself towards the end of my addiction to marijuana journey, and I think it's something we have to shed some more attention on. So we're going to talk about what it is, we're going to talk about the different stages of psychosis, and then I'm going to offer you guys some simple solutions to help you along the way, okay? If you're new to the channel, here at Addiction Mindset Recovery Coaching, we help people quit nicotine, THC, energy drinks, and adult media content. So be sure to subscribe to the channel today if you're new and you find this information valuable. I used to be addicted to THC products from the ages of about 23, 25 years old to right up until about 28 years old. And towards the end of my journey using cannabis, I was getting really heavy into the THC cartridges. I was using both black market cartridges and I was using medical grade carts as well too. I was also a fan of dabs and, dry herb and bong rips and one hitters and whatever you could have, I was consuming it. Now, towards the end of my journey, I started to develop symptoms of psychosis, and it was really, really weird. On a very basic level, psychosis is defined as a disconnection from reality. And a lot of people smoke weed because they want to be disconnected from reality for a period of time. But there comes some points in life where you don't want to be disconnected. And if you can't snap out of that stimulation, that disconnection, it's absolutely terrifying. And that was the direction that my mental health was starting to go towards the end of my cannabis use. That, along with symptoms of Cannabinoid Hyperemesis Syndrome, where I was getting the nausea, I was getting the extreme weight loss. I wasn't vomiting at this point, but I had the muscle pain. Really a horrible experience for me towards the end. Okay, let's start by defining psychosis and what it is. And guys, all this information is taken from the National Alliance on Mental Illness, and we're going to take it from Psychiatric Times, Cannabis-Induced Psychosis, okay? So, psychosis, disruptions to a person's thoughts and perceptions that make it difficult for them to realize what's real versus what's not real. Seeing, hearing, and believing things that are real, or having a strange, persistent thought, behavior, or emotion. This is often frightening and confusing. I can tell you guys 100%, my emotions were off the walls. I mean, one day I'm bouncing around 100 miles per hour. The next day I'm so depressed I don't ever think I'm going to see the light of day again. And I really think this was one of those early symptoms of me for cannabis-induced psychosis, going through these extreme highs and these extreme lows. I don't know exactly how to define manic behavior, but I think it's safe to say I was probably starting to exhibit that throughout points of my cannabis use journey. I get a lot of people reaching out to me about the behavioral things and the mood swings, and I'm starting to realize that I think they're experiencing early onset symptoms of psychosis. Now, who winds up experiencing this? A lot of people who reach out to me, they are using excessive amounts of cannabis, and it tends to be the THC oil cartridges. It's the people who are using dabs. It's the people who are using edibles combined with the THC cartridges. I see a lot of this, especially with the black market products. And I think it's very important that I make that point very clear, because a lot of times I think people will call me and say, Dr. Frank, I've been smoking carts. I later find out they were buying them off of Snapchat or something like that. And I now think I have cannabis-induced psychosis. And the reality is they have a substance-induced psychosis, but it might not have been cannabis that you were smoking. A lot of people don't realize the amount of other drugs and other ingredients that they're adding to these THC oil cartridges, especially young users, or, a guy that was 26 years old with his doctorate didn't realize it either. But I just like to throw that out there. I'm not blaming all of this on weed, and not everyone who smokes weed is going to experience this. So I just want to make that clear. The other thing about the people who are experiencing this is there's usually an addiction, which makes it really hard. The person using cannabis is usually at a point where they know it's not good, like something's going wrong, and they can't stop. And even worse, that addictive voice in their brain is convincing them that the cannabis is the solution to this problem, which makes this problem an even bigger problem. Now, I want to play a little game with you guys to identify the stages, early stages, the signs and symptoms, the warning signs of psychosis. So put up 6 fingers, and each time you can relate to one of these things, put a finger down, okay? Have you seen a decrease in your schoolwork or your job performance? Have you seen a decrease in your concentration or your thinking clarity? Has your suspicion or unease around other people escalated? I remember starting to feel a little bit of this, like everyone was kind of out to get me. I was kind of paranoid. It was very, very strange, and I would actually often lash out at people during this time. Very strange. Has your self-care declined or your personal hygiene? Stupid stuff. Are you brushing your teeth before bed at night? Are you taking care of yourself and showering when you wake up in the morning? Spending lots of time alone. Have you started to seclude yourself from other people? Are you uncomfortable all of a sudden around other people? And have you had strong, inappropriate emotions or feelings? Dysregulated, inappropriate emotions, and you know it. Have you been experiencing those things? And I'm going to ask you, how many fingers do you have up? Let me know in the comments. Each one of those that you could relate to, you put a finger down. If you have more than 2 or 3 fingers down and you consume a lot of cannabis and you've noticed maybe some problems after consumption, you might have to ask yourself, okay, something might be here. And remember, guys, a lot of these stages could also be indicative of addiction as well, too. The decrease in hygiene, the isolation, all of these things are signs of an active addiction as well. Now, I want you to put up another 6 fingers, and we're going to talk about the signs of the first episode of psychosis. So, are you hearing, seeing, or tasting things that other people do not? I didn't really experience that. Do you have persistent, unusual thoughts or beliefs? I definitely did at the time. Do you have inappropriate emotions or no emotions at all anymore? Are you kind of walking around numb to life? And this could be either you experience a really depressing situation or a situation that should bring you a lot of joy. Are you just emotionless? Are you withdrawn from family and friends? Has your concentration decreased? And once again, has your self-care decreased? If you have a combination of these things, these might be signs of your first episode of psychosis. So again, how many fingers do you have left up? Are you watching this saying, wow, maybe this relates to me? Because if that's the case, I need you to pause and I need you to start to see cannabis for what it is for you. Something that was maybe once really good, a big benefit. Your relationship with cannabis might be changing. And these warning signs, these changes in behavior, this is cannabis's way of telling you, hey, you might need to break up with me because things aren't going well right now. Now, a full-blown episode of psychosis, hallucinations, hearing voices, strange sensations or feeling, these could be physical, seeing glimpses of objects or people that are not actually there, or visual distortion. I want to go into this. When I was heavy into smoking the carts, I was getting the visual distortions, and I did not realize that until much later on after I quit and I started to learn more about psychosis and what it is. This is you're looking at someone, you're looking at something, and it's blurry. You can't make it out. It feels like you're in a simulation, like literally talking to your friend, and it's just kind of a blur. It's really freaky. A lot of times, this condition will actually bring people into an optometrist or an optician to see if they need new contacts or glasses changed. And a lot of times, the eye doctor doesn't, they don't know. They check your vision and they're like, things look good. I don't know, maybe you have a little bit of a problem. So has that happened to you? Another symptom of psychosis is delusions. Are your thoughts extreme And are you beginning to think of yourself as having special powers or seeing yourself as a god? I don't know. I never did. I mean, I think I'm a pretty cool guy, but I never thought that. But some people do get delusions when they experience psychosis. They become delusional. Now, what causes this? And I think this is a very important part of the conversation. I don't think we should always turn to someone who uses cannabis and say, well, it was the cannabis that caused this, because that might not be the case. This individual might have had a genetic predisposition. They might have had pre-existing trauma, like a lot of people who struggle with addiction do. They might have had other history of other substance abuse disorders. Again, I mentioned even energy drinks have been linked to psychosis when consumed in too high amounts. Certainly alcohol and other things like that. Is there a physical illness or injury that exists? Or even bigger, is there a primary underlying mental illness such as schizophrenia or something like that? It's hard to say though, what came first, the chicken or the egg? Was the mental illness already there? Or did cannabis lead to mental illness? I don't know. I don't know a lot of times in an individual. I think if you look back at your life before your journey with cannabis and you say, you know what, I think I was happier before then, I felt more normal before then, maybe you got to ask yourself, is cannabis taking that mental health in a really negative direction? Okay. How do we fix this? What do you do if this is you? Well, you have a few different options. You can start with a psychiatrist. And in most cases, a psychiatrist, a medical doctor, is going to prescribe you drugs. They're going to give you maybe antidepressants, antipsychotics, benzodiazepines, all different substances, okay? That decision is between you and your healthcare provider. That is not for me to make. That is not for me to diagnose. But I think it's something you should strongly look into and you should research. When you look at the research, with or without prescription medication for psychosis, people who receive motivational interviewing regarding their cannabis use and helping them reduce their cannabis consumption do the best, period. That is based on research. Fixing psychosis is not based on a medication. There is not some magic pill that's going to fix this. Quitting and abstinence is the only way to fix this. The other things might help. They might make it far worse. I have had patients where they've been prescribed things for this and it has become worse. So I really want you to just, before you jump into a treatment, make sure you're talking to someone who knows what they are talking about, okay? Don't work with someone who is strictly going to try and treat the symptom, okay, without treating the root cause potentially being cannabis addiction, okay? I think talk therapy with a psychologist, an addiction recovery coach like myself, Addiction Mindset offices, you can work with us by checking out the link in the description below. I think those are great options, and possibly even in conjunction with traditional medical care. Now, there's a few other things that you guys have to keep in mind when you're going through this. One of the best things you can do is modify your lifestyle. So, basic stuff. Start to regulate your sleep. Go to bed and wake up at the same time every day. When you sleep at night, that's when your brain detoxes. That's when your brain heals. So regulating your sleep is super important. Another tip for you, avoid drugs. Avoid the alcohol. Avoid the cannabis. Avoid the caffeine. Get away from the stimulants. I know it's not easy to do those things, but if you're struggling, work with someone or get into a group. Get help. Other lifestyle modification, exercise. Exercise is super important when it comes to the health of your brain. Speaking to people who bring you joy and who give you that release of dopamine. Interacting with people is so important. And this is often one of the hardest things for someone who's struggling with psychosis to do. But even if it's just with a family member or a friend that you're really close to, that interaction is crucial. Getting outside, getting sunlight. There's a million different ways to approach this, but the way that we have seen most success in my offices is helping people with lifestyle modification, reassuring them that everything's going to be okay, and making sure that they do not use this substance again. recovery is anywhere from a few days to a few weeks to a few months. I've worked with people for over the course of a year going through this, but I would say almost everyone gets back to 100%. At least the people that I've worked with. I don't know. Maybe there is permanent damage that can be done, and again, you got to rule out other problems. Maybe there's another problem that's causing this, and maybe it's not just cannabis. Maybe there was a misdiagnosis by another healthcare provider. They thought it was cannabis, but you really have something else going on. So I think it's really important that we look at this from a complete picture and not just through a narrow lens. Okay, you guys, I hope this video helps. I hope this sheds some light on things. I really hope those of you that choose to indulge in cannabis and those of you that are getting involved with it, especially if you're younger, like, just be aware this stuff can happen, and I'm seeing it happen a lot, and we need to spread awareness about this. We need to spread the message on this, because it's no joke. It's no joke what these people have to go through. What I went through with this was no joke. It was challenging. All right, guys, follow me into the next video where I talk a little bit more about these topics. I'll see you guys there.